The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about podcasts. Now, many of you know what that is, some don't. We'll tell you what they are. But the Department of Public Health and Human Services is accessing the power of storytelling via podcasts. And they want to illustrate the benefits and programs that the department offers individuals through successful stories. So stay tuned. We'll be right back.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Respite care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, respite care provider, on the unexpected benefits of helping people in need.
Being a respite care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore. I mentioned that we're talking about podcasts, and a lot of people out there say, sure, I know what a podcast is, some don't. But the Department of Public Health and Human Services is harnessing this tool to educate Montanans and maybe people beyond Montana about what programs we have here in Montana that are available to you, and we're doing it via storytelling. You can understand somebody else's experience if you've had that experience rather than someone just saying, here's the eligibility, 1, 2, 3. So of course we've got some experts from DPHHS joining us. On my right is Linda Krantz, your communication specialist, and Jennifer Van Sickle, your health educator. Welcome to the show. It's great to have you both here.
Thank you.
And Linda, let's start with you. We're talking about podcasts. For the people that know what they are, we don't have to educate them much, but what is a podcast and how maybe do people access it?
So basically what a podcast is a pre-recorded discussion.
Mm-hmm.
In our case, Jennifer is our host,
Mm-hmm.
and she sets the platform and then allows the people to tell their story. So it's not really an interview style, but there's a little back and forth discussion. It's something that you can download from any electronic device. You can play it on your phone, you can play it on your computer. Our podcast is called Talkin' Health in the 406.
Yeah.
We have a website, talkinghealthinthe406.mt.gov, and you can go to that, see the podcast, click play and listen.
Uh-huh. And what are some of the topics to generalize that you're looking at right now?
Right, the first topic that we have recorded is our diabetes program manager, Melissa House. It's her story from being diagnosed with type 1 diabetes in childhood, her story of how, trying to be a normal kid through her teenage, early adult years to developing chronic kidney disease and needing a double transplant.
Oh, that's amazing. And now, Jennifer, how is DPHHS using this, and what got them going there? I mean, this is a lot like our Aging Horizons show. It's like, let's educate people, and you're using another vehicle, but how did they start looking into this?
Right. You know, what really planted the seed is one of our coworkers, a team member at DPHHS. She did a road trip. She's visited with her line of work with a lot of people throughout the state, especially those in like eastern Montana, farmers and ranchers who we honestly have a very tough time reaching. They tend to read the morning newspaper, they work long, hard hours, and they don't do social media. They don't do anything else to really make it easy for us to reach them. And she asked them, you know, what do we do? How do we reach you? What are you doing all day in that combine when you're harvesting wheat? And they said, well, I listen to podcasts or audiobooks. And that's what planted the seed. And so we did more research. You know, we talked to ranchers. What are you doing 2 a.m. when you're waiting for that cow to calve? They're listening to podcasts, many of them, or even commuters. And so we thought this is perfect because this is a great tool. At DPHHS, we have so many programs that offer a lot of great benefits, a lot of help for people, and we tie into counties, local communities that offer that help as well. And we have a hard time letting people know that help is there. So we're using this through the power of story, because story tends to stick with people more. And as they're telling the story, I can pepper in little bits of data that we have pre-checked on. We can pepper in suggestions, but not only that person's success story of how they lived with an issue or a chronic disease can help really stick with the listener, and the listener can remember that and know, you know, I think that person used this program. I'm going to go look for it because that can help with my condition or my neighbor's condition. And so it's a great way to kind of reach out and just educate.
And get people talking.
Yes.
Well, now, Linda, you know, we're talking about podcasts, and if you do it well, it looks really easy. But there's a number of people in the background that are helping out. What does it take in order to prepare a podcast and to actually get it to broadcast?
Right. We have a team of people that help us. Like I said, Jen is our host, and she does a lot of research, and she is involved in getting the data put together, getting everything set up. I do more of the distribution, getting things on our website, getting communications pushed out on social media. We have another individual who, Mary Duthie, who is our editor of our podcasts, and she's our analytics person. She also helps us with some of the data. And then we have Marilyn Trevino, who is our behind-the-scenes tech person, if we need a hardware, software, any platforms. We also are very fortunate. We have an individual at the CDC Foundation who actually is a sound engineer that has helped us getting this going as well. And then we've been able to tap into the RTTC, who has been a mentor for us, and RTT stands for
Rural Telementoring Training Center.
Thank you.
Based out of the University of Texas.
Thank you. I knew that was a tongue tire for me. And so that we've had a really great team helping us get this launched.
I bet it's real eye-opening seeing what has to go behind the scenes to make sure it happens. Much like Aging Horizons with Video Express, I mean, they make it work, and it's like almost magic to the uneducated people in that process.
Right.
But it's kind of fun, isn't it?
It is. It is. Yep.
And you keep learning.
Yes.
Well, how tough is it being a host, real quick there?
You know, it's challenging, and especially as you go back and listen to the audio of yourself, and Mary, our editor, really picks up on it, and I don't tend to hit the ums and the this and that. You know, I don't do the filler words. She says you drag your words out. You know, and, I guess I do. So, but it can definitely be challenging. I've been fortunate so far that I've had some very good talkers as our guests that are very happy that once we can get them going, then they roll. And
they can go.
Exactly.
Well, it's really an education. You know, I learned a lot being a host, and unfortunately we're drawn to a quick close on our first segment. We've got a lot more to talk about in our next two about podcasts and how you can access them and learn about programs that are available through the Department of Public Health and Human Services. So stay tuned.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about podcasts, particularly how the Department of Public Health and Human Services is accessing the power of storytelling to illustrate programs that are available to all Montanans that may help you, your family members, or some of your friends. It's a really new approach to informing people about programs that can really help you out. Returning are our two guests from DPHHS, Linda Krantz, your communications specialist, and Jennifer Van Sickle, you're a health educator. And Linda, let's start with you. We're talking about podcasts. How easy is it for a user to access them? And there's a variety of ways, right?
There is. It can be as simple as, hey Alexa, play Talking Health in the 406.
Yeah.
You can go to our website, which is Talking Health in the 406. .mt.gov, and the podcasts are listed there, and click play. Or you can visit any of the platforms that you listen to, any of your podcasts, Spotify, Apple Play, Amazon, wherever podcasts are available, you can find Talking Health in the 406.
Yep, and I know my, smartphone, I can just say, okay, Google, find me Talking Health in the 406, and it'll come right up, and I just have to talk to find it. And now Jennifer, let's talk about some of the topics that we have in the can already. What are they?
Right. So the podcast out now is about diabetes, as Linda mentioned in our prior segment. Up next, we also have a person which is out now, actually, about a man who was born with normal vision. Was normal vision up until about age 10, 11, 12, 13, and then he started to have some issues with his sight. He managed to hang on with some low vision for several years and went completely blind in his 30s. And so with that episode, he talks about the struggles, what he went through, what was there to help him, and get back to a normal life. And we also have a special episode about his guide dog, Fife, and how to get a guide dog. Everything that goes into that was incredible. Also, after that, we're going to have a podcast about our emergency medical services in Montana, which is the ambulance services, the local ambulance, and the history of that. Did you know you used to need to take a Hearst in order to get to the hospital? I'm just going to leave that as the teaser out there. We'll put it that way. And so we talk about the history of ambulance service in Montana, all the way up to what it is today. And we have a wonderful guest who shares some great stories from riding on an ambulance service, being part of an ambulance service for many, many years. And, we do have a few others down the road, like stroke and other cardiac issues, but we would really love to get more guests. More guests.
Yeah.
Absolutely.
So if the people are watching right now saying, more guests, what's the ideal guest? Or what kind of criteria would you like to see to get them on the air?
You know, we have a couple ground rules. We don't want to talk about anything political. So that would be COVID vaccine. We're not going there, but we would like a positive story. So if you have any sort of health issue or had a unique experience, and now you're living good, you know, we would love to hear that story of what happened, what you went through, your struggles, and then coming through to the other side, the success. And if anybody would like to reach out, they can email us at that address. talkinghealthinthe406.mt.gov is our website. talkinghealthinthe406@mt.gov is our email. And we would love to have a conversation more.
And I think too, what you're talking about, you like an aspect of how they accessed public health or services. There's more beyond public health that the government offers. And like when you were talking about ambulance services, a lot of people might not think that there's someone at the state that sets a standard. I mean, is it just a local issue and we're we have various things that we can access? But it's important to understand. I don't think people really understand all that government does for them.
Right. You know, and how intermingled it is from the state public health service, which goes to the county level, also even into the hospitals and different community organizations. We're becoming more and more interconnected, trying to help people, and it can be tough to reach people and let them know this help is here. We want to help you. So it's a lot of great benefits out there.
Well, now, Linda, when we're talking about, you're a communications specialist, and you guys have been trained to a certain standard in order to do this podcast. When I started Aging Horizons, just go down and do a show. You've got a lot more experience, background, and training, right? Yeah, can you tell us about that?
Yes, Jennifer and I both had the privilege of attending an online course through Harvard Medical School called Media and Medicine. And we learned different techniques in communications and how to get messages out there. And podcast was one that really interested us because we hadn't seen that. Like we said earlier in the first episode, especially with some of our rural residents here in Montana, they don't do social media. And so how can we reach people? Podcasts are portable, they're on demand, so you can listen to them when you have time to listen to them. And then also we had the privilege of working with the RTTC, the Rural Telementoring Telehealth Center. Training Center. And they have individuals that do podcasts professionally also, and so they really guided us and helped us. And then we do have a young man from the CDC Foundation who's a sound engineer. His name is Josh Coep, and so he's been helping us along with this as well. So we've had a lot of great guidance, a lot of really helpful mentoring along the way to make this a good podcast.
Good podcast. Well, it sounds real interesting. I wish I would have listened to this before I came here. But it was kind of short notice for me. But for our viewers, again, we're talking about podcasts in Montana, particularly as they focus on Department of Public Health and Human services that they offer individuals. And as they mentioned, some of the topics, diabetes, we've heard that word a lot, but maybe we really don't know what it is. Well, the important part of the podcast is to educate you through successful stories. And we have more of that coming up in the next segment, so stay tuned.
Wildfires rage in forests and developed areas. Where do you live? Are you familiar with your community's risk and its capacity to respond? If not, it's time to learn. Talk to your neighbors. Ask about the wildfire risk and the evacuation plans. Decide what you can do to mitigate the hazard. Everything you and your neighbors do right now might save property and lives later. If there's no group to join, form one. Get help at firesafemt.org. Paid for by FireSafe Helena and aired by the Montana Broadcasters Association.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, and my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about podcasts, how important they are, particularly as we focus on the Department of Public Health and Human Services programs and how they're helping people out there. And they're using a podcast to enlighten people via storytelling, which is a novel approach, I think. And Linda, let's start with who benefits from these podcasts that once they hear them?
Sure, really all Montanans. Anyone who listens to them. Our audience is really Montanans. That's who we're targeting, family members, loved ones. Anyone who listens to it could benefit. Because of the power of storytelling that we're using through the podcast, people remember that good story. For example, our first podcast is on diabetes. And so people will remember Melissa's story. And then they'll go back to our website where we have some of those links that talks about the resources that she talks about in her podcast, and that they can link to those resources, because as we all know, if I said, hey Brian, here's a great resource if you know anybody who has diabetes, you'll forget. But when you connect it to that story and you remember where you found that story, it kind of ties the package together.
Yeah, and you know, I think it also ties the person into it, because either I have those symptoms, I've had those, my loved one has them, and it makes it more personal rather than running down a list of numbers. That kind of just flows right by, and if you don't catch them fast, you forget them. Well, now, Jennifer, you're the host of the show, and you've heard some good stories, haven't you?
I have. And that's our goal of this podcast, is to make it, we've all sat around the campfire, and shared stories of our lives. We want this to be as close to that as possible, because those stories stick. And then you can just sit back and listen and get carried away in this person's story for 10 to 30 minutes, depending on the podcast, and remember what happened to them.
So the podcast is about how long?
On average, ballpark 20 minutes. We do have some as short as 14, but others go as long as 40 minutes. And so the listener can choose, I've got a long drive, I'm going to pick the longer podcast, or just a quick minute and take the shorter one.
Yeah. When you were talking about storytelling, people telling stories, I said to their children, reminded me of Native Americans, where for generations, forever and ever, there's all a verbal history that goes down. And I imagine they were all stories. This happened to me, and it could happen to you, and maybe you want to learn and take a different path when something happens. So, but now who's the target audience, Jennifer? Or, I'm sorry, Linda.
Really all Montanans, and any people who visit our great state. So all age groups.
Yeah, and they all have an interest, and I wonder if they just did a simple Google search, would some of these topics come up as a priority because you're in Montana or someplace?
If they search this topic, diabetes podcast Montana, it should pop. It should pop right at the top, because it has all those right keywords.
Yeah. So you pick the topic as you get more stories done.
Yes,
this will come up.
Yes.
But now, we have the information, but what we want to do is we want to connect the individuals with the local resources. And Linda, what are some of the resources that they can access that are already in the community they might not be aware of?
Sure. We have all kinds of resources. It could be a Walk with Ease program. It could be a Stepping On program to help people help prevention from falling. It could be a diabetes prevention program. It could be a quit line. Someone wants to quit using tobacco. All of those, and we have local programs throughout Montana. And so if you have questions about that, probably the best place to do would be to call your tribal or local health department and find out what you have locally.
You know, and I'd suggest too the area agencies on aging. They're sort of brokers of information. They have a program, information referral and assistance, where they maintain a lot of information. Where's the closest foot doctor? Things like that. But they'd be able to direct you. But I think what's important is what you're pointing out is that you have local resources that are right there that people maybe are not aware of.
Correct. And oftentimes when people are diagnosed or have a condition happen in their family, an event, the first thing they think of is not going to mt.gov and finding out information. But all of our programs are evidence-based, and so they're fabulous programs. People have a lot of great success with them, and we want to drive people to those resources because we do have so many in the local communities.
And you said two words there that I think are important, is evidence-based. There's a lot of information out there. The internet's wonderful, but you kind of have to watch the source. And if I go into a government agency, I'm going to generalize. They know what they're doing, and they want to help you. That's the thing.
Correct.
Usually there's a phone number. And Jennifer, maybe you can tell us what are some of the fun things that might have happened during an interview with you?
You know, I would say the best was having the guide dog Fife with us there. Fife was great, and it was really fascinating to not only see Fife in action, walking with our guests, you know, from out on the street back inside, and just seeing how life is without vision. Yeah, that was interesting. And then, of course, we've had lots of other quirky issues of microphones not working and technical fun. Yeah.
And it's like, oh, how do I get it working really quick? You need someone like Video Express is like, we know how to do it, just don't touch the microphone. That's what they tell me. Well, that's great. Well, I'd like to thank you both for bringing this innovative program to Montanans and sharing it. And it's more than Montanans, since it's a podcast. If someone has a loved one in Florida, they're wondering about what's available in Montana and what issues there are, they can access that. Then they can find out the local numbers to access too from out of state. So they're caring for their loved ones through innovation. When we started this show, podcast, that wasn't a word. And who knows what it's going to be in the next 10 years. But thank you for doing this show, doing the podcast, and bringing information to Montanans, because it'll make a difference in people's lives.
Thank you.
And again, for our viewers, I want to thank you for joining us here on Aging Horizons. We'll have another wonderful show for you in just 1 week. So I look forward to seeing you.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.